Nursing infection precautions with 3 NCLEX style questions. The standard precaution system applies to blood, all body fluids, secretions, excretions, non-intact skin, and mucous membranes. The 6 examples included here are blood, saliva, urine, mucus, breast milk, and semen. Standard precautions are designed to reduce the risk for transmission of microorganisms in hospitals. Standard precautions should be applied to all patients, regardless of diagnosis or presumed infectious status. Transmission-based precautions are used for patients known to be or suspected of being infected with highly transmissible pathogens. Transmission-based precautions include airborne precautions, droplet precautions, and contact precautions. Airborne precautions are used if the organism can cause infection over long distances when suspended in the air, such as chickenpox, measles, and tuberculosis. Droplet precautions minimize contact with pathogens that spread through the air at close contact and that affect the respiratory system or mucous membranes. These droplets spread by coughing, talking, or sneezing, such as influenza and bacterial meningitis. Contact precautions minimize the spread of pathogens that are acquired from direct or indirect contact, especially multi-drug resistant organisms. Contact precautions are used for infection spread by skin-to-skin contact with such pathogens such as C. difficile, MRSA, and VRE. Our NCLEX style question states, the nurse teaches the staff that standard precautions should be used when providing care for which type of patient? A. Pediatric and older adult patients. B. All patients regardless of diagnosis. C. Patients who are immunocompromised. D. Patients with a history of infectious diseases. You may pause the video and consider your answer. The answer is B. All patients regardless of diagnosis. The nurse is providing post-operative care for a patient with human immunodeficiency virus infection after an appendectomy. What type of precautions should the nurse observe to prevent the transmission of this disease? A. Droplet precautions. B. Contact precautions. C. Airborne precautions. D. Standard precautions. And the answer for this question is D. Standard precautions. The patient is diagnosed with vancomycin-resistant enterococci, which is known as VRE, infection in a surgical wound. What infection precautions should the nurse use to prevent transmission of the infection to others? A. Droplet precautions. B. Contact precautions. C. Airborne precautions. D. Standard precautions. The answer is B. Contact precautions. If this content was helpful, consider subscribing for more videos. Please like and comment below, I subscribed. Write I subscribed in the comments below so that I can respond to you personally. Once again, thanks for watching.